big why about chiropractic is to understand the simple reflex. And the simple reflex is best made by an analogy, is best understood by analogy. And that analogy is you stick your finger on a flame of a candle, the pain goes up into the core, and you instantly pull the hand back. And it's a protective reflex, and most of us know that. On some reflexes, the doctor will tap on a tendon on the leg, and you will feel that tendon contract and your leg will move. And that lets you know that the reflex is working the way it's supposed to. But that's a simple reflex. One nerve going in, one nerve going across and around, one nerve coming back and drawing the hand away. The problem is that there's nothing very simple, because it literally takes hundreds, if not thousands, of nerves, and many times it requires a coordination of effort where not only does one muscle contract, but another muscle has to relax. And I call that the kinetic chain, the movement chain. The movement chain is normally seen aberrated when people have knee problems and foot problems and basketball injuries and football injuries and things like that. Very common, doesn't have anything to do with age. It has to do with the lack of coordination. Joints will wear out because of that lack of coordination. A lot of those reflexes that used to go just to the core that we talked about, they're very simple, they have to go up into the brain. And they roll around, and the brain decides what nerves have to be stimulated in order to cause something to occur within the body. If a phone rings and you run up the steps to answer the phone, your heart will automatically start to pump more. The blood vessels will shunt blood to your leg. If you hopped up on one leg, it would shunt it to that one leg and not to the other leg. It would cause, if you were afraid, the glands would dump, and various organs would change as your body did the things that were necessary for it to prepare to handle the movement of going up the steps. Bronchial tubes would dilate. When you relax, there's another group of nerves up here that tell the body to just slow down, to digest, to repair. And your body is in a balance between those two sets of reflexes. Those reflexes go right over the same nerves that get pinched when people have back pain. But when you pinch the nerve in the spine itself, it can cause those reflex circuits to get broken and to become aberrated. Now modern medicine and modern technology has allowed doctors to discover something that's been going on forever, and that is that chemicals are actually the communicators between nerves, and it's not electrical. It's not like a hot wire in your house where you plug it in and it goes to the toaster and it works because of the electricity running through it. In the nervous system, the wire that goes up here of the electrical charge along the nerve turns into a chemical and then goes in and stimulates another nerve, which comes up to the brain, which then communicates with other nerves chemically, and then back down, maybe to an organ, causing the bronchioles to dilate or to constrict, or the digestive organs to work one way or the other. It'll shunt the blood one way or the other, or stimulate the heart. All of the connections of the nerve that goes to the organ is chemical. I don't know what the number is now, but 5 years ago they said there was over 3,000 different chemicals in the brain that the brain uses to communicate to the body, depending upon the information that it receives off of these nerves that come up. And they all have to pass through the hole where the nerve comes into the spinal cord and that goes up into the brain. nerve or refurbish those nerves by adjusting the spine, the reflex then resets, and then the body starts to heal instantly. That's where the miracles come from. And it doesn't make any difference whether it's glandular or whether it's eliminated with the sinuses or the lungs or the kidneys or the bowels. It doesn't make any difference whether it's the unbalance of the autonomic nervous system, where the nerves are irritated in some way, some fashion that causes those reflexes not to work right. It doesn't matter whether it's the digestive system or the circulatory system. I mean, you could run up the stairs and have the heart rate to go up, but then it should slow down. But what if it doesn't slow down? What if it goes up and sticks, and the blood pressure goes up and sticks? Now you know why chiropractic works, because those reflexes get out of balance. Most of the side effects that I have from an adjustment is people getting better from some other problem than they come in for. If they come in for the back pain and the bowel problem clears up. And often the time that I hear about it is when they say, does this have anything to do with constipation? Because I don't have any more constipation since you fixed my back. That I hear a lot. It's too bad I don't hear it first, but that I hear a lot of. Someday you're going to hear about somebody having an issue with a problem that they have had chiropractic care and they've gotten results. It could be glandular, it could be digestive, it could be that the whole immune system now is talked about as being controlled by the nervous system itself. That's in the medical literature today. So as you see these videos, and if you talk to patients, you will now understand the why. It's the big secret behind chiropractic. It really can make a difference when that nerve is pinched and those organs are not fed the information to work in a coordinated fashion with the rest of the person, and they get sick, and that's why people get sick. It's not the only reason, but it's a big one. Thank you.